and so we have people joining in on TikTok. So today, hey bro, how's everything? So we're going for live video on Facebook as well, and as well as on TikTok. Good, very good, thank you. Now, hi everyone, I'm Sunanpo from Center of Balance, the acupuncturist. Welcome to Center of Balance Live. So tonight, I'm going to show you some acupoints for shoulder pain. Shoulder pain. Question: do you guys suffer from shoulder pain? Found your video very helpful. Thank you. So any of you suffer from shoulder pain? Please say yes. Reply yes if you suffer from shoulder pain. Now, do you have pain right now, or you have ongoing pain but you don't have pain right now? You feel it sometimes. Now, if you do have pain right now or you feel it sometimes, please say yes. Headache, we have done the headache point previously. Go to my Facebook or my YouTube, the video is still there. Or go and watch it. Okay? Okay, sometimes. Okay, good. Good to know. Thank you. Thank you for sharing. Now, tomorrow morning, which is New Zealand time, 11 a.m., and Daisy, my colleague, is going to present a live webinar on this platform, which is on Facebook. If you're on TikTok, I'm sorry, not on TikTok, just on Facebook. Right, on our Facebook page. Then the topic will be acupoints for wrist pain in the wrist. Okay, acupoints. Now today my topics mainly focus on shoulder pain. If you have anyone who suffers from shoulder pain, please tag them in this live video or share this live video for them. And at the meantime, please give me a thumbs up, like, send me a love, something like that, and say hi to me and let me know where you from, because I would like to know where are you from. Okay? Right. First, we talk about how to do some examination. So two things that we need to know in examination, because this examination is going to work out whether later on after applying the acupressure point, we're going to test it out again with this examination. Okay, thank you. So ask yourself right now, if you feel the pain or stiffness or tightness in your shoulder, either that side or that side, doesn't matter which side. Okay, ask yourself, how bad is the pain out of 10, from 0 to 10. Right. If I want to stiff your shoes, bro, what does it mean? Best TikTok video I've ever seen. Thank you very much from Philippines. Thank you. Look, if you have pain, please try to ask yourself, how bad is the pain? 1 out of 10, 2 out of 10, or 10 out of 10. Okay, or 5 out of 10. Because after this acupressure point practicing, you're gonna ask yourself the same question again. If you don't feel the pain, you don't feel the stiffness while you sit here, you don't, it's silent, that you don't moving it, you don't feel any pain, don't worry. The next thing I want you to do is do some range of movement of your shoulder. So follow me. Level out like this. Okay? And both hands, I'm going to test it. If you can raise up high like this you are normal. If you get your waist like this, that's not normal. That's normal. If you feel pain, then ask yourself, how painful is that? Is it 1 out of 10, 2 out of 10, or 3 out of 10, or 10 out of 10? Can you go above this? Low back pain in hospital right now. That's not good. You should go to my page, on my TikTok page. There are lower back pain points that I've showed you. Just go and find a video and test it out yourself. Hope that helped you. 7 out of 10 when you raise your hand. Okay. That's the problem. Some of you may not have any pain. When you raise up, it just couldn't go any further, or it's just stiffness. And that's the problem too. That's the problem too. And the acupressure point may help you as well. Okay. Then next, now you test out this side. Please test the opposite side hand. Raise it up and test out whether there's any pain or not. And next, raise your hands up to the side. It was front to the side. Going up there. Again, you need to be able to raise up to here. Okay. If your hands only 90 degrees, that's not good enough. If it's pain, that's not good. And ask yourself, how bad is the pain? And see how you, whether you can lift it or not. If you can't, and then you need to have a look. How high do you actually reaching up? If you raise up, this is 90 degrees. Over here, from here to here, that's another 90, which is 180 degrees. Right? If you from here to here, that is 45. 90 plus 45, 135 degrees. So you need to do that for yourself and write down how far can you go. Okay. Same as the opposite side, doing this. Okay, same as the opposite side too. Right. Some pain, yep, loose. Shoulder blade chronic ache only on one side. Okay, I understand, thank you. The next one, over here. Reach your back, your shoulder, your hand, go to the back. How far can you go? Well, which one's difficult? Because you don't know how far you can go. Okay, just go there. You should not have any pain at all. And same as that side. I'll do another one if you can do that or not. If you can't do it, that's another problem too. But my one can't touch it in here, but I can do it in here. You see? I can touch it a little bit. Alright. If there's any pain, please raise it down and ask yourself how bad is the pain out of 10. If it's not too bad, that is good. If there's no pain, that's good. Now, the range of movement is very, very important because you need that. Okay. Now, if you want some exercise, I show you an exercise yesterday, and that exercise is for your neck, headache, upper back, and shoulder. So with this video, this live video, I'm going to show you some acupressure point. But if you would like to learn that particularly exercise that may help your shoulder, please go to my YouTube channel, search Center of Balance Hamilton, Acupuncture Hamilton, New Zealand, and you will get to my YouTube channel and watch that video. Combine the acupressure point today. And dizziness. Okay. Thank you. Let's start. According to the Meridian Theory, so we want to choose the point. We need to choose the point. When we choose the point is actually according to the diagnosis. Way about the pain. Is the pain in here or here? In a different meridian, we choose different point over here for the shoulder pain. But for you, you're not an acupuncturist. I'm going to show you a very simple way to get to it. You don't need to understand. You don't need to have the knowledge of meridian at all. Okay? So just go for it. You can't do this. Had 2 impingement surgery on my left shoulder, which still ached up. Okay. If you can't do it, don't force yourself to do it. Just simply do the acupressure point. You get some relief straight away. Right. Here's the acupressure point. This is my hand, so you can do left hand or right hand. It's up to you. And the tool, I'll show you the tool later on. Let me show you the acupressure point first. Okay. The acupressure point is in here. You use your thumb. You see your wrist over here. From here, this is the thumb side. This is the little finger side. From here to here. Press it in here. Do you find any tenderness spot? If you do, please, on the thumb side first, press it. Please press and rub for 10 seconds. Can you find the tenderness spot? If you can, please rub it for 10 seconds. Okay, that's about it. And go to, from here, go to the little finger side. Now, we go a little bit. So just right next to the point that you just pressed, go a little bit. Look at here. Just a little bit from here to here. Now, from here to here. This is the middle. This is middle. Between here and here, in the middle point, there's another point. Okay, between here and here, there's another point. So basically, there's 3 points. Let me press it for you. You see, one is on the thumb side, the other one is in the little finger side, another one is in the middle. There's 3 points. For you, I want you to make an extra point at between the middle and the side, and middle on the side, so it becomes 5 different points. So if you have a very big hand, then it may be more points. So for me, 5 points good enough. Second one, press it and rub it. Do you feel any pain? If you do have pain over here, please rub it for 10 seconds. Now, some of you say that you have neck pain as well. Please follow this as well. Go for it. That will help your neck as well. Alright, go for it. And then after 10 seconds, the middle one, press it hard, because in the middle one you have tendons over there. Press it hard, press and rub it. Do you have any pain in this point? Any tenderness in this point? Are you following? If you are following, please reply 1. If you are following, please reply 1. This is for your shoulder, but it can also work for your neck. Right. The next one over here. So this point is between middle and the side point in the middle. Press and rub. You got it? Thank you. You part 1. Thank you very much. With this one, now I'm gonna show you another tool. This tool, if you have a longer nail in your thumb, that may give you fingernails marks, and you don't want to do that because it hurts, and you may hurt yourself. You may break the skin. Yes, I have pain when wrapping. That's good. That's good. Guess what? Over here, it will help your neck. It will help your shoulder. Although we focus on the shoulder, but if you have pain on the opposite side of your wrist, it can help too. If you have pain in your hips, it can help too. If you have pain in your ankle, it can help too. Okay, but let's just talk about shoulder today. Now, use your knuckle. This is your index fingers, fully bended, and then use your thumb to lock on the nail here. So using here, press in here and rub. Keep rubbing. Do you feel the tenderness spot? And go to the next one. Press it and rub it. Now when you rub, you can go sideways, up and down. Sometimes you go sideways, you feel more tender. Sometimes you go up and down, you feel more tender. And you can work it out sideways or up and down. Sometimes sideways and up and down, no pain. Sometimes you feel only sideways, not up and down. Sometimes either up and down and sideways, you feel a lot of pain either side. So you can up and down or sideways. Up to you, okay? Now if you're on TikTok, you haven't followed me yet, you just join in. Please, on the top, I think it's on your left top, there is a button that you can follow me. You can press and follow. Okay? Press, keep pressing, please. This will help your shoulder. Okay, that's it. Now, normally you need to go for 3 times, 3 sets. So give it again for another 10 seconds. Right, let's do focus on here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Go to another point closer to the middle, but not middle point. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. What are we doing? Keep doing it. Do it more. Another 10 seconds. This is for your shoulder. Shoulder pain. On the middle point, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Another one. Move to the next one. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Some of you got result already. Simply amazing. Do you get relief now? That's good. Keep going. One last point in here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. For those of you, if any of the points are not tenderness, forget about it. You don't have to rub it, and you can just focus on those points that is very tender. Okay. So I'm gonna go again. This point is a, you heard sound clack clack clack. That's good. This one for me is very tender. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. A lot of relief. That's good. For me, in the middle one is quite tender too. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that one's quite tender too. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that one I have nothing. Okay. Now, ask yourself. You've done all this. Ask yourself. For those of you, you felt pain before acupressure point, then without any movement, range of movement, moving your arm, you feel pain. How is it now? Do you feel better? How bad is it now? Ask yourself the same question. How bad is the pain? If it was 10 or it was 7, it dropped down to 2 out of 10, that's great. Or 3 out of 10, that's great. Right? You got relief? Congratulations. You're so smart. Good on you. Next, for those you didn't feel any pain, but you only feel pain or stiffness, or you can't reach your arm up just now when we tested before the acupressure point. Now you need to test yourself. Raise your hand up to the front. If it's in the right hand, you do it on the right hand. If you do it on the left hand, you do it on the left hand. If both sides, you raise both sides up and see. If you just now you do here and then you start to feel pain, and now you can raise up further and then you feel pain. And that's good improvement, which means you're on the right track, and keep going. That makes sense to you? Why? When you test out this side, test out the on the side over here. Alright? Test out that. Okay. Test out. If you have pain, you stop here. Just now. If you will reach here up to here, and then it stop you going further, good improvement. You're on the right track. Let's do Carhot. I don't know what I mean, sorry. Okay, now test out reaching your back like this. If you feel pain just now or stiffness, try it and see whether you feel any pain or stiffness or not. I have a very bad lower back pain. If you have any suggestion, would really appreciate that. Hey, Chantel, right? Follow me on the top, and then you go to my page. I have some video that's for lower back pain. Okay, and if you go to on my TikTok, if you go to the top, right, and that's Q&A, and there's a link over there. You click it in, and you can sign up for free webinar, and we will send you the video, the recording video. I've done acupressure point for lower back pain, acupressure point for neck pain, acupressure for knee pain, acupressure point for headaches, and exercise for neck, shoulder, headache, and upper back pain. Okay, all this video we recorded. Like today's video, I actually recorded on Facebook and I posted up on YouTube, and will send the link to you. Okay, my goal is to help as many patients as I can through the social media, because we help a lot of patients in our clinic, and in general, if it's not locked down, I can't do this live video for you. But now it's because of lockdown, then I can do this video for you. And yeah, if you want to follow me, please follow me and go and join me and follow me and sign up for my free training of the live webinar. Okay, and will lead you to our Facebook. So if you sign any of my free webinar, will lead you to our Facebook page, because on our Facebook page we mainly do live webinar on our Facebook page. Okay, because I can do a lot of things on my Facebook page. I'm very new to TikTok, but thank you for you guys to joining in. Thank you very much. This work I am as taunted, so my left shoulder has been really hurting. I can lift it now. Thank you. Oh, that's awesome. That's awesome. Okay, for you guys that has been working for you, hey, to be honest, it doesn't work for everyone. If you watch my previous video, the reason it doesn't work, one of the reasons is the structure issues, very bad structure issues. And the second thing is, sorry, this one sneeze. The second thing it doesn't work is because, you see, all the meridian over here, this meridian linked to small intestine, this meridian linked to sanjiao, which is linked to kidney, this meridian linked to large intestine, or here lung meridian linked to lung, and over here pericardium, and over inside over there is heart meridian. So linked to different organs. The reason you have pain or you're not healing properly, that's because lack of circulation. And the lack of circulation is because the organs imbalance. It's not function properly. When it's not function properly and you don't have enough circulation over here, right? Or there's blockage over there. So in acupuncture, we have the philosophy here is because there is a blockage in there, so we need to unblock it. So with unblocking the blockage, we have two strategies. One is local point strategy, which pain isn't here. I can go and massage it. Most people know this technique. Okay, it's not special for me to show you this because it's easy. You can do it yourself. But two outcomes with local acupuncture points. One is you got very good result. If you do get very good result, keep going with that. If you don't get good result from that, you feel pain, a lot of pain, sometimes you make it worse, then stop it. Therefore, you can do distal point. What I just showed you is distal point technique. Those are linked to the organs, correspond to your shoulder. And those linked to your brain correspond to your shoulder. That's how it make it worse. And those can make more blood flow on your shoulder. Does it make sense? That's why though you guys say that, well, it's helping. That is the one that's helping for you. Frozen shoulder is much harder. Depending how bad is frozen shoulder. If the frozen shoulder is just a little bit of pain, it will work very well for you. No different at all. But if the frozen shoulder, you can't move your hand and the pain is very bad, again, the structure happen and the organs function is very bad, then therefore I suggest you to go your local acupuncturist and Chinese medicine herbalist. You need some herbs, you need some acupuncture to help you further. Does it make sense? Right? Same as those of you, if you're doing this, it helps a lot. That's good. Keep going it. Every day, you're going to practice it. You're going to practice every day, at least once a day. And whenever you feel pain, stiffness in your shoulder, give it an extra time. Okay? Give it an extra time for it. And continue it until you have no pain in your shoulder. If you have no pain in your shoulder, that spot, tenderness spot still there, please keep going because it will come back. Now, if you find this help, if the pain is 7 out of 10, and you can bring it down to 1 out of 10, 2 out of 10, it keep coming back, and you can't get any further, please go to your local acupuncturist or Chinese medicine herbalist to get some help, because that mostly is coming from your organs. You need to treat your organs. Okay, this is just one of the techniques that I use in my clinic, and I show my patient how to do that as well. Okay, so I watched the lower back video, started with 10 out of 10 pain. Now I have little to no pain. Fantastic, Melanie, you crack it. Fantastic, and thank you for letting me know. Thank you. Yeah, sometimes it's just simple as this. You know, it's not hard at all. My technique that I show you, it is very simple, and it will work for 80 to 90% of you. Okay, if it's very bad, which means you don't respond, you have the pain over here on those points. When you work on it, it doesn't work for you. Two things: very bad structure issues, very bad organ function. Then what do you need to do? You hit the point, but the point that you don't respond to it, an acupuncturist or Chinese medicine herbalist, you need to go and find them, okay? And they would help you. I'm still feeling pain on my left shoulder, but for the right shoulder, the pain's gone. Okay, good. Left shoulder still a pain. Go to the next opposite side and keep going. Okay, very good one. Then you can extend from here down to here, about 3 fingers from here down to here. What happened? Some of you pain is not in here, only in here. This is going to the joint. Sometimes when you say shoulder pain, it's not actually in the joint. It actually comes down to here. It go up to here. So you need to find some point down here. If you find point, for those 5 points, extend 3 points down here. Same technique. If you extend to here, you find the tender spot, please keep going with those spots. Okay, keep going with those spots. Then it will help you. It will help you to get more relief. Does that make sense? So for you, right shoulder is good, but left shoulder is still painful. Let me give you two strategies. One is go to the opposite side and keep doing the same. Two, extend the point, extend 3 more points down here. So 5 points over here, right? Times 3 more points, which is 15 points over here that you need to cover. Does that make sense? If that one doesn't work for you, go to the opposite side, extend to that point as well. And hopefully that will give you relief in your shoulder. If that hasn't helped you, then we have a lot of other strategies, but I hope that's good enough for you. Today, I'm going to show you all those things. Then hopefully next time I can show you more. Okay? Tea time, invite me again soon. Can you teach acupressure point for shoulder? Okay, I've got all this covered. Thank you for sending present. Thank you. Yeah, please share my live video. That's gonna help a lot of people. And thank you for joining. Acupressure point for lower back pain. Please, on TikTok, like my page, follow me, and then go to my page. There is one video or two, I can't remember, for acupressure point for lower back pain, and that's gonna help you. Right? Hello, I'm in pain in the shoulder joint. Shoulder joint. I don't have the video probably in my page. I may have the video on that too, but we'll cover that in the next few days. In the next few days, we'll cover that as well. How many times do I have to do it in a day? 1 time, at least once. And whenever you feel pain, give it an extra time. At least 1 time a day. Okay? Golf treatment, yes, we can do that. Let me know what is your joints, and we'll do it another time for you. Okay? That's it for today. And for TikTok, please go to the page above Q&A. There's a link. Click it in, and there's a lot of free webinar. Sign up either of them, or you can sign up as much as you can. We'll send you the video, recording video, and because those videos will send you an email and invite you to our Facebook page, and because a lot more happen in our Facebook page. Okay? Yeah, go to our Facebook page. Thank you very much, and I'll see you next time. And if you, thank you, see you. If you're on YouTube, please subscribe, like, and share. See you next time.